A recent episode of This American Life talked about new scientific studies showing how poverty-related stress can affect brain development and diminish the ability of young children to learn and perform in the classroom. What is your plan for early intervention to help low-income kids in our district deal with stress in their home lives?
That's a combination of services. I think you do that with the school district and the developing partnerships we have with public health and with the county board of medicine that we had. Actually, when I was principal at Gompers, we had the van coming in working with kids. Now that's on the high school level. On the lower grade levels, there are a number of programs that work as pullouts, but in terms of supporting, we don't have a lot of support for families that are struggling, and that's something we need to spend more time developing. Okay, as we go, we learn more about all of those impacts on young people. We still haven't really gotten a good handle on what to do with students that are homeless. We don't really get enough of that information to know how to really approach that. We can network with a lot of sources, including our best source of information, which are our parents and our students. So there's a lot of things that need to be done. I don't think anything of that's been very well organized yet in our area.
Okay, one of the ways that we're trying to address this in our district is through community schools. And community schools are schools with wraparound services that help these individuals, young kids, and they're funded through state and federal grants. And you know, these services are critical. Kids come in with bad teeth, they come in with mental health issues, and this is a place where they can go and they get these. You know, in our elementary schools, it's very important. In the high school, you look at the James Morehouse project. When I go there the first thing in the morning, the minute that door is open, that place is full. It's addressing the needs of children. When you look at federal and state tendencies, is to push those services down to the local community. Same with prison costs, but I'm not going to go there. So really, it does come down to the dire need of paying attention to these. And one of the things, another critical aspect to this issue is great teachers and great administrators. When they work together, they create an environment in the school that's welcoming to families with problems. And they show, yes, you know, you can work this out. You can attain a higher level than you ever thought you could. A lot of students coming from low-income areas don't have the education that we do. Their parents don't. You know, so it's a very difficult and very diverse conversation. So when the school system itself becomes the home, becomes the model, that's where growth really happens. And I think that that's what we have to foster in our district to deal with some of the really serious issues we have.
We have health centers in all of our major high schools and also in our middle schools to deal with that. What we need is healthy living and healthy eating. There I mentioned the soda tax in Richmond, where our Kaiser doctor is saying our kids are putting on too much weight in grammar school and in middle school. We have to do something. He took a brave stand. I'm one of the signers of the resolution in Richmond. We have to do something about what we eat. There's never enough exercise, and what we drink. When a parent tells me that her daughter drinks 2 cans of Coke in the morning before she goes to school and 2 cans of Coke in the evening, I want to go back to the house and show her an empty plastic bottle of how much sugar that child is consuming. This coming Friday, we're dedicating the brand new Perez Dental Clinic, where students will have the ability to have their teeth fixed at Perez. When the new Coronado is rebuilt, we'll have a dental and a medical clinic within the school. When the bond measure passes and we rebuild Lake, I also want to have a dental medical clinic in Lake for that part of San Pablo. We need to educate our students more. When we outlawed the drinks in our high schools, we faced a massive rebellion on the part of our students. They said, no, we want our Coke and our 7-Up. But they got used to it. Do we need to have more education? You see these large billboards throughout the county saying, I'm the mother, I decide what you should eat. I think we need to stress that. Healthy eating, healthy living, it's very important. I think all of our schools should have dental clinics. At least take care of that in itself. We eat too much greasy food, we eat too much fast food, and we drink too much Cokes and 7-Ups with all the sugar content. We have to educate ourselves and educate our students. And the parents are learning. When the Catholic priest at St. Mark said, "No more Cokes," you should have heard the rumbles in the hall reacting to Father Ramiro's statement. Thank you.
I favor expanding our existing 3K program, which is already quite successful in the neighborhoods it's serving. We need one down here in the south end of the district. I would center it at Stige. I think it was desperately needed. It's providing high quality early childhood development with very highly trained teachers and really robust and rigorous early childhood development program. And I don't think it's an accident that some of our higher performing flatland schools are also served by our 3K program. So I would expand that. I also think we should investigate returning the family literacy program that we had through adult school that works with families to engage in reading and English. I think that would be a great start. We could also expand that to broader aspects of parent education. I know as a parent of teenage girls, I could certainly use an education and not the one they're providing. So, I could. There are a lot of instances where I could have used help as a parent. I'd like to see more coming. I'd also like to see wraparound services like we have at the high school available at least at our highly impacted flatland schools where are most centered in poverty and violence, and we provide community services right there on campus. We do have community engagement workers in a lot of our schools, but sometimes the actual follow through to the services falls down, and we need people to facilitate that. So those three would go a long way to obviating the problems that come with poverty and stressed childhood.